In clinical medicine examinations, short cases comprise of an important component. In the final MBBS examination, it accounts for 1/5 of your final 100 marks. That is 20 marks are allocated for short cases. Therefore, passing short cases is an important thing for both passing the whole exam and also those who try to get classes and distinctions. So this video will help you to improve your performance in the short cases in clinical medicine. Let me first tell you what's the main difference when you prepare for a short case in clinical medicine compared to long cases. Now, you would appreciate that long cases test a big component of knowledge, but short cases test a big component of your skill, because in performing a short case, two examiners are watching you and they are watching your completeness, the technique, and whether how accurate you are eliciting the physical signs. And after that, you are supposed to interpret those findings and communicate it to the one of the examiners of the examiners pair. So basically, short cases, there are 5 major areas of testing. What are they? The first is the completeness of a short case examination. I will allocate one whole section on this completeness of 4 different systems. Then the technique, the most important part, where the examiners are watching you and you are supposed to do a complete examination with correct technique in eliciting ankle jerk, knee jerk, in eliciting percussion note. You have to follow the correct technique. That is important. The third one is to findings. The findings can be normal findings or abnormal findings, and you are supposed to differentiate the normal from abnormal physical signs. Next comes the interpretation. When it comes to interpretation, you should know which findings you should pay more weight. There may be findings which are not very sure about, what you call soft sign, physical sign, and there are findings which are hard signs. For example, pansystolic murmur is a hard physical sign, and ankle clonus is very hard physical sign. Deviated cardiac apex beat a hard physical sign, whereas reduction of the movement of the chest wall in the the lower zone is, in my opinion, is a soft physical sign, where not many people, 2 people will agree on that. Some way there is no reduction, some way there is reduction. So because of that, you cannot put much weight on that when you interpret physical signs. So that is, interpretation plays a big role in the final diagnosis. Finally, communication, the body language you use during presentation of your short case at the end of your examination period.